is a natural cessation or stopping of a woman's menstrual cycle, and it marks the end of fertility. Now, some of you might be excited about that, some of you might not be. There is a love-hate relationship with menopause, definitely. But menopause can be a good thing. We're going to dive into what menopause is, the signs and symptoms of menopause, what are some of those complications, how are we able to manage menopause, both using the hormonal therapy and the non hormonal therapy. That is the focus for today. Now, let me introduce myself. For those of you that don't know me, I am Dr. Babs. I am a board certified family physician, and I'm the founder of Living at Your Finest company. I'm a health and fitness coach, and I'm a woman that is truly, truly, truly honored and thrilled that you're making an investment in your health today by joining us in the Health Exchange chat room, where we talk about all things holistic health so that we can be empowered to possess our worth, to nourish our bodies and spirit, and to become health champions. So, welcome once again to be part of this talk series. Now, it's time for us to check in the chat room. We have a guest today. We're going to pick her brains about what she knows about menopause, and then we'll take it back into the discussion room. We are going to go into the Health Exchange chat room, and I have with me my darling cousin in person of Mrs. Omolola Adekeye. She's a business consultant for entrepreneurs and businesses in the US and internationally. So I am so excited that she's with us. Her time is precious and valuable, so we're not going to take too much of it, but we want to pick your brains today on menopause. Welcome, Omolola.
Thank you. Hello, everyone. It's nice to be here.
Yeah. So
Yeah.
tell us, we've
So,
reached that age now, we're like, that 40s. We're not going to age ourselves on
yeah,
screen, but we're around that place where menopause is,
we're up there. We're right
of some
there. Yeah.
concerns.
Mhm.
Yeah. So, we want to pick your brain. We're using you, on behalf of the community. What do you know about menopause? What is your take on it? What age does it come? Just some
Okay.
information that you know about it.
So, I've been fortunate to have a lot of older friends. So I've
Okay.
been experiencing a lot of things about menopause even before it's hitting me. So I'm like, okay, this is what they're talking about and that kind of thing. So I think menopause is generally when it's for women and typically between the ages of 40 to 50, but more prominent in your closer to your 50s, then you start noticing it a little more. So there could be times where you have lapses in your cycle,
Yes.
for instance, and sometimes also it comes with a lot, depending on what you're doing, is what I'm finding out from a lot of women that sometimes they don't even realize that they're going through menopause because they're so busy.
Yeah.
And some others, I mean, there's the hot flashes that happen. There's just fatigue and a lot of mental stress, kind of not really being too sure of your body or even yourself sometimes.
Right.
So I guess for everyone it's different,
Yes.
my approach is understanding that I think there's a metamorphosis of some sort that is taking place in the human body, in the
Yeah.
female body, once you cross over 40.
Yes.
And that begins with a lot of things. And we should have a manual, that prepares us. It's just
Yeah.
not thrown at us. Uh-huh.
Yeah.
And I
Yeah.
think different cultures have, I mean, yes, I know that there might be medicinal ways of taking care of this, but I also
Mhm.
think different cultures have some herbs and stuff that can aid the
Yes.
mental, help the body, help the hormones, and that kind of thing. So I kind of generally go more. I lean more towards
Yes.
that, towards trying to understand what my body wants
Yeah.
and trying to see where I can get it. So I hear people throw things out there like black cohosh,
Uh-huh.
um, vitamin E, borax oil,
Mm-hmm.
those kind of things. And some
Yeah.
people say they experience dryness, in the special places and stuff like that. Oh yeah, it's a lot of.
Yeah. Well, we picked the right person in the health exchange chat room. You have nailed it. And I love the word you
Oh
used. You
really?
said metamorphosis. Metamorphosis is going on in the female body. So yes,
Really?
absolutely. You got it right. That's really what's happening.
Okay.
There's changes going on in the female body. The age range, you're about the age range 45 to 55. You spoke about the symptoms that some people experience. And you also said something that was so paramount. You said it's different for different people at different stages. So absolutely. And I like that you also gave us some of your, information in terms of holistic care that is not the conventional medication, so absolutely. So are you aware of some other like behavioral things that people can do? Like for instance, you spoke about hot flashes. So what are some of the things that you think you can do? If you're always hot or cold, what are some of those behavioral things that you've heard that might be helpful before we
Mm.
go even to medication?
So a lot of people talk about exercising,
Mm-hmm.
doing kind of trying to kind of the regimen exercise that you enjoy that you keep doing. So some
Yeah,
people walk a lot, and some people say just doing stuff like yoga, tai chi to stretch
yeah,
out your muscles and stretch
yeah.
out yourselves can also help. You know, and some people just say, look, slow down and relax. Just relaxing and allowing yourself to understand the body and
Right,
the
right,
different because it's different from before, so
right.
so
Yeah.
that's what I've heard some women talk about. And yeah.
Yeah.
Hmm.
And when I go back into the discussion room, because this is the exchange chat room,
Yeah.
I will definitely highlight those behavioral modifications that we can do. Everything that you mentioned is important, but exercise, kind of exercise, what we wear. So that you sweat a lot, so you have to wear something comfortable where you're not sweating, just be
Yeah.
comfortable, stay hydrated. So there are a lot of things that we can do, behavioral things that we can do. And of course, there might be a role for medication, but we, first of all, will lean on the sides of, functional medicine and integrative medicine, things that we can do naturally that can
Yeah.
help, ease us into that period that we're going through. Now, in terms of medication, have you heard of any medication that maybe people might take and what it's for? Are you familiar with any of them? I will definitely break them down when I go into the discussion room, but have you heard anything
uh
by the side?
no, not like
Yeah.
going taking, I don't know if that's medication, but I've heard of hormonal something, so I was just wondering.
Yes,
I think
hormonal replacement therapy. Yes, so you heard
yeah.
right. So hormonal replacement therapy, but there's an indication for that. There has to be an appropriate use for that because as
Okay.
medications, they have side effects. It cannot be used in the absence of your provider. So yeah, so that's definitely one of them. You talked about dryness in the special women area. So there are creams that people can use, to help with lubrication because life still goes on, right? We want to live at our finest health in personal development. So we definitely need to,
Yeah.
yeah. So
For
we got to
sure.
keep it, we have to keep it, moist and everything. So yeah, do you have any questions that I can, break down when I go into the discussion room, dispel if there's any myth out
I
there?
think, yeah, I think, I mean, one thing I think is really, really might be really helpful is maybe helping people understand to be ready for these changes. 40
Okay.
people they just start wondering what's going on. Why is my period feeling more heavy than it used to? Why am I more, I don't want to use the word depressed, but just like a little,
Down.
funky in
Yeah.
the headspace.
But yeah,
you know,
headspace, yeah.
and you're
Where
just
you're
and you're just
emotionally,
wondering, and it's really not, yeah, it's really not a function of what's going on around you,
mm,
because that's always been there. You're
yeah.
always probably shouting on one child,
Yes.
something, before you were able to manage it okay, and all of a sudden, it's just
Yeah.
foggy. Just, I think preparing women, preparing
Okay.
women for these things, and it's not a question of it just bumps up and you're like, what is going on? I think just having that things to people could do to prepare once they start noticing
Okay.
a few things off, to calm down. Yeah, I
Yeah,
would love to hear
definitely.
more about that. Yeah.
Definitely. I'll be happy to dive into that. I'm in that stage right now. So I know that I've had to do, have that internal check and find out what can I do to
Yeah.
manage this. So definitely, they say failure to prepare is planning to fail. So we don't want to
To
fail. We want to
prepare
live at our
to,
finest.
yeah,
Yeah, so we want to live at our finest health. So we need to prepare so that we're enabled. We know what to do and we can
sure.
guard ourselves and stay in good health. But so thank you so much. I really appreciate
Thank
giving us some of your time. I know you have a lot doing, but we really appreciate it for representing the community and by throwing out those questions and answering some questions for us.
thank you so much. It's been a pleasure being here. Thank you.
Menopause is defined as the lack of menstruation for a whole year. And at that point, you can no longer be pregnant, at least naturally. Menopause is a natural process that occurs as the ovary begins to age. It produces less reproductive hormones. The body begins to go through several changes. So less hormone, as my guest said in the health exchange chat room, metamorphosis begins to take place. There's a lot of changes in the woman's body. There's less estrogen, less progesterone, less testosterone, and two big hormones that affect the women's organ will be the FSH, which is known as the follicle stimulating hormone, or the LH, which is known as the luteinizing hormone. All of these are low. Some of the noticeable changes that will be observed will be that there's less active ovarian follicles. And the ovarian follicles are the structures that produce and release the eggs from the ovary wall, allowing menstruation and fertility. This tends to occur between 45 to 55. So that is what you hear around the age where women tend to attain menopause. And if it's earlier, again, it could be because of some underlying factor. Maybe there was a surgical removal of the ovaries, maybe there was radiation. There's several other reasons why this might happen earlier. Now, when menopause does begin, symptoms usually somewhere around the 4 years before the symptoms finally go away. And it's also estimated that 1 in 10 women experience menopausal symptoms for 12 years following their last period. Oh my goodness, I don't want to be one of those. But most women generally, it's 4 years. The median age for menopause is 51. Again, it averages up 2 years earlier in Blacks and Latina women. Some studies have said there might not be any relation to race, but whichever case, we know that there is a genetic component. Now, there's several factors that help to determine when we will get to menopause, and we'll dive into that a little further. But let's talk about some terms, right? I'm sure you've heard about perimenopause, and all that means it's around menopause. So it's a time when your hormones begin to change in preparation for menopause. All right, as my guest again said, you remember she talked about metamorphosis? This is when things begin to change. This is the period where there's irregular bleeding. You're either bleeding too much or too little, or you're having a cycle twice a month. That means something is beginning to happen. Your menstrual flow might be heavier, as I already spoke about. Now, another term that I want you to be familiar with is postmenopausal. So, meaning that you're no longer in that menopause phase where you haven't seen your cycle for 12 months complete, then you now become postmenopausal. That is typically, outside of that 55 age. All right, so those are some terminologies I want you to be familiar with. Now, let's talk about some of the symptoms. What do you need to be aware of? My guest said she wants to know. People want to know what to expect so it doesn't just hit them in the face, right? So every woman's menopausal experience is unique. Let me just say that very quickly. Symptoms are usually can either be severe or mild. It could be shorter or longer. So it really depends on several factors. Now, even though menopause can cause some uncomfortable symptoms, such as hot flashes and weight gain, for the most part, medical treatment is not needed, maybe just conservative management. All right. Now, let's talk about a few things that you would see and how you can manage those, right? So, a few things that you might see is the hot flashes. You hear that all the time, you know, hot flashes, night sweat, there's flushing. 75% of women experience hot flashes with menopause. And it's usually, during the summer, it could even be during the winter. It really, really does depend. There's several other things that tend to occur. So there's reduced muscle mass. There could be painful joints. It could be stiff joints. All of this is all because there's a decline in the estrogen production, which affects the amount of calcium in your bone. So that's why I said there's a love-hate relationship. You don't want your cycle, but then when your cycle goes, then you're depleted of calcium and the vitamin D that is needed for your strong bones. And of course, in the absence of vitamin D and calcium, that leads to osteoporosis, which just means thinning of the bone. And thereby being susceptible to hip fractures and bone fractures. So these are definitely something to be mindful of. Insomnia, just not being able to sleep. It could come from just all the time hot, just so uncomfortable, very moody. Another symptom or complication could be just vaginal dryness, leading to painful sexual intercourse. It could reduce libido because of decreased hormones, decreased sex drive. All of these are a result of hormonal changes going on. So the more you empower, the more you know what to expect, and you can make some adjustment for that. Weight gain is a big one. I remember, I always used to hear that once you hit 40, you have that mid waist spread or that, lower body spread. This is because of the weight gain due to a slower metabolic function. Depression is one, mood, unstable changes because of the hormonal imbalance, which affects your memory, it gives you headache, dry skin, brittle hair, it's a lot that tends to happen. It can be sore breasts. It could have less fullness of the breast. They say at this point, the breast begins to sag. Now, the one that is very, very concerning is the heart. Heart disease tends to increase around this time, and that's because decreased estrogen actually prevents your body from retaining the flexible arteries that we have. It also impacts blood flow. So we definitely need to pay attention to what we eat more as we get older, because we can afford for our arteries and our vessels to be compromised by the decreased estrogen. So we need to help, our heart and our vessels with proper diet. Other things that tend to happen, increased urinary tract infection, whether because you're going to the bathroom a lot, you're having incontinence, so there's a lot of them. No, but I don't want you to be discouraged because there's solution, right? You just need to know what the issues are and their solutions. All right. So how is menopause diagnosed? Now, it's a clinical diagnosis, all right? So you don't need to run to the doctor and say, I want to get tested to see if I'm menopausal or if I'm perimenopausal, postmenopausal. If you haven't seen your cycle for 12 months straight, that's the typical clinical diagnosis. Again, if you're going to need blood work, that's going to be a conversation with your physician. It depends on your symptoms. It depends on your history. It depends on, what else is going on. Will determine if they're going to do blood work. They're going to probably test for the hormones to see what levels and where they are. But that's a conversation you need to have with your physician. Most people that might get blood work might be those that have gotten, reached menopause less than 45, which is the upper limit, the lower limit of when you actually begin to have menopause. So they might, because of the complications, right, the risk of osteoporosis, fractures, heart disease. So they really want to make sure, is there anything else going on? And so they might be the ones to get blood work. But otherwise, most people don't need to have a blood work. Just based on history, will determine if it's menopause or not. All right, so let's keep it rolling. Now, the important thing I need us to understand is treatment. We have two main forms of treatment, and I'm going to break them into categories. We have the non hormonal, which will comprise of home remedies, behavioral modification, and then we have the second type of treatment, which will be hormonal. Let's talk about the non hormonal therapy, right? So, with these, definitely, these are reserved for people that have mild to moderate menopause symptoms. And so you're trying to take care of it naturally by using home remedies. And the home remedies, we have three main categories here. The first one I want to talk about is nutrition. I know, nutrition. It's always about nutrition, right? Nutrition, we have to make sure to help with that hormonal shift, that hormonal imbalance. It's trying to sort itself out. We don't want to make it any more complicated than it is. Good nutrition. We got to eat foods. We have to eat foods that are rich in calcium and vitamin D. So, meaning that greens, leafy veggies, kale, all of that helps. Spinach, they all have really good, vitamin D content. Of course, there's nothing like the good old sun. Go out somewhere around that noon, gives you the best vitamin D. Lots of food with, tofu, beans, sardines, all of this have lots of vitamin D and calcium. You want a meal that is rich in fruits and veggies because they help to minimize those symptoms, right? They're low in calories. They help you maintain your weight anyway, right? You want to avoid trigger foods. Trigger foods such as alcohol, cigarettes, caffeine, all of those spicy foods, they all tend to trigger menopausal symptoms. All right. So we got to cut back on those. Definitely doing a try and error and figure out what those trigger foods are for you. Now, you want to eat foods that are high in what we call phytoestrogens. So that mimic the effect of estrogen. Estrogen is the female hormone. So they help to balance our hormones. It's seen typically in places like Asia countries like Japan. And so that's why they have less menopausal symptoms in those part of the world. So where do we find some of this phytoestrogens? It's found in soybeans, soy products, tofu, flax seeds, sesame seeds, beans. So those are the ones that tend to have more of these. Now, there's been that controversy about soy, whether it's good or not. I mean, overall, it says it's good. If you can tolerate it, fine. If you can find other ways of getting your estrogen rather, that's good as well. Now, it is important that you also ensure that you are eating foods that are fortified with lots of water. So other than drinking water, right, you do need to increase your water because typically whenever you don't have estrogen, you're dehydrated most of the time. You're so dehydrated, you're so dry. So you got to drink lots of water. If you eat veggies like cucumbers, watermelons, those tend to have lots of water in them, right? So eating those will definitely help in addition to, of course, drinking lots of water. Very, very important. How much water? Well, what's your weight in pounds? Split that by half. That's how much water you need to take in ounces. Now, if you have any other chronic issues, like for instance, congestive heart failure or a kidney disease, you do want to inquire from your provider, your primary care provider, how much water you need to have. This is general information. It's not specific to any individual person. Now, what are some other behavioral therapies? Keeping cool, staying comfortable, wearing loose clothes, especially at nighttime, making sure that you're comfortable, keep your room cool, avoiding heavy blankets. Sometimes we don't think about these things, but they do matter, making sure that we don't have, we consider using waterproof sheets to protect our mattress. So these are also very important. Portable fans, we do need to manage our weight. Weight is so important. So we manage our weight by cutting back on our calories, making sure that we're eating more nutritious foods, like I already mentioned, and exercise. Exercise is important. The recommendation is 30 minutes, 5 days a week gives you 150 minutes. Advance as tolerated. Exercise definitely helps. Now, Communicating your needs with your family definitely helps. Talk to your partner, talk to your family so that they know when those mood swings happen, what's going on. Make sure that you don't bear this alone. If it's beginning to take a toll on your mental health, please reach out and speak to somebody because it is real. It can cause some anxiety, it can cause some depression, and you'd be trying to figure out what is going on with me. Why am I so impatient? Have those conversations. It definitely will make a big difference. Some other things is taking good care of your skin. As I alluded to, it can make your skin totally dry. So using good moisturizers, making sure that you drink lots of good, lots of water that keeps you hydrated. Sleep, 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 very important. You got to make sure that you're sleeping. That will help to manage your menopausal symptoms. So recommendation is 7 to 9 hours. Anything less than 7, you are compromising your body's ability to rejuvenate. So, what are some of those things that you can do to make sure that you promote good sleep? Lavender oil. I love lavender oil. I sprinkle it on my pillows. I have it behind my ears. I have a video on sleep habits, so you can watch that, right after this one. Right. So those are definitely things that you can do. Now let's talk about herbal remedies. Unfortunately, evidence behind these are not so strong. Some people testify that it helps them, some say it doesn't, but this is actually there. But just make sure you tell your physician, your provider, that you are taking herbs. Black cohosh, if you haven't heard of that already, it's one of those that they speak highly of. It's the most popular and longest studied natural herb for hot flashes. And really, why is it so? Why? What's all the craze about it? Well, it's derived from a plant that is in the buttercup family and it's been used for centuries. All right, so it can be in several forms, whether tablet, capsule, mixed with water. It tends to stimulate what happens in the brain with serotonin. So it helps to regulate the mood. You're not, depressed, and it also regulates body temperature. So that's why they say it works. I haven't used it yet. I'm trying to just drink more water and eat healthier. I'm at that age where I'm beginning to, get those menopausal symptoms. St. John wort. That is another one. It's another popular herb that is out there in the United States. It's been shown to help with menopausal and mood swings, improve sleep relaxation. Plant. It comes from a wild flowering plant called Hypericum perforantum. That's a mouthful. The leaves and the flowers are harvested and dried, and then it's brewed. And you can take it in a pill or a liquid form. Again, some people say it works. I don't know. Just make sure you talk to your provider if you're taking it. Ginseng. Ginseng is also another herb that has been shown to have a lot of therapeutic health benefits, and it's been there for several years in the Korean as well as Chinese community. It helps with fatigue, anxiety, stress, and it's known as a normalizer and an energizer. All right, it can be in the form of tea, powder, extract. Now, let's talk about supplements. Supplements and natural supplements and nutrients that tend to help menopausal symptoms. Vitamin D is a big one. I already talked about that under the nutrition category. It helps as a building block for a healthy body. It promotes the healthy bone renewal, normal cell growth, and hormone balance, which is all important for menopausal women. All right. Now, it's known as a sunshine vitamin. I already alluded to that. You want to make sure that you're taking a good amount of this. Other things that you want to make sure that you're taking is magnesium. Magnesium has been shown to help as a supplement with menopause. Other things that you want to take in supplements category, probiotics, prebiotics, that's just the bacteria in the gut and the food that you feed the good bacteria so that it can help to absorb the nutrients properly. We've heard about primrose oil. Primrose oil, even evening primrose oil has been very helpful. Now, I'm coming to the last category, and the last category is practicing relaxing techniques. There's several relaxing techniques like yoga. We know how that helps with the mood, it calms you down, it relaxes the muscle. There's one that I just recently learned about called box breathing, and that is the 4-4-4-4. So you inhale for 4, hold, exhale for 4, hold. And it really helps to calm you down. Meditation has also been helpful. Acupuncture falls under this category. There's some, critics about this. Some people say it's whether it's placebo effect, but some have said that it's worked for them. So you just have to figure out what works well for you so that you're not completely relying on medications. Now let's quickly take a deep dive into the hormonal therapy. There are hormonal therapies that help, and they tend to help for women under the age of 60 or with a 10-year history of menopause onset. It helps to manage hot flashes, weight changes that involve osteoporosis, vagina atrophy. They can come either in the form of topical, right, where you just apply into the vagina area to help to lubricate, or you can take it by mouth, oral hormone replacement therapy. But all of this has to be done under the guidance and supervision of your primary care provider because they know the indication for when a patient needs to have it. There's some contraindications for hormone replacement therapy. You definitely can't use it if you have a family history of breast cancer or if you smoke, because this tends to increase the risk of breast cancer and so many other reasons. So you want to make sure that this is a question you ask your primary care provider if you're a good candidate for hormonal replacement. Now, there are other treatments to help if there's the thinning of the hair, if there's depression, depending on the symptoms, there are different treatments. All right. Now, I just love prevention is better than cure. So, at this point that menopause is not an illness, right? It's a natural part of life. It's just the changes that we all go through, women go through. And though its symptoms can be difficult to deal with, if we eat right and we exercise regularly, we can alleviate and prevent them. All right, so don't forget to talk to your doctor about what you're experiencing. Don't do it alone. Communicate with your family, let them know what's going on. All right, we've talked about several treatment modalities for managing menopausal symptoms, and I hope that you've seen the big picture that generally health, right, is our way to go. Health is the way to go. Stress reduction, exercise, yoga, all of these are very helpful. I hope you feel empowered now that we've talked about it. We've braced all the different ways that menopause can show up. We've talked about when it starts, what it is, all the terminologies pre and post, how it can be tested, how you can know it's even started, and how we can manage. So a lot of information today. Well, if you're interested in more videos like this, please don't forget to subscribe, all right? Hit that bell so that you won't miss any video on health related matters. And don't forget to share with your friends and family so that we can all be healthier together. Until next time, remember that you need to live at your finest holistic health because you deserve it and you most certainly can achieve to live at your best.